House Bill 47. Imagine this. A survivor of sexual assault goes to the nearest hospital in a rural Texas town. The law says they should get follow up care and support, but the hospital doesn't have the money, training, or staff to meet the new state's rules. So the survivor leaves without help and no one is held accountable. What the bill says it does? House Bill 47 promises stronger protections for survivors of sexual assault. It expands who qualifies as a victim, improves notifications from the legal system, and adds post-care reimbursement for hospitals, and limits where sex offenders can work. What it actually does. That means survivors now have more legal rights and hospitals are required to help, while local providers lose the ability to opt out, even if the state doesn't give them funding or support. Who benefits? Survivors of sexual assault, advocacy groups and nonprofit service providers, state agencies and licensing boards, law enforcement unions. And who pays for it? Rural hospitals and clinics with limited resources, survivors who live in underfunded areas, local governments expected to meet new mandates without new funding, landlords and rideshare operators expected to comply without guidance. And why it matters. Good intentions are not enough. When the state creates new obligations without funding them, services break down unevenly. People in big cities might get support, while people in small towns are left behind. Without timelines, audits, or public accountability, the system becomes a patchwork of promises with no guarantee. And questions to ask your lawmakers. Why require hospitals to offer care if you're not giving the funds to do it? Why is reimbursement handled behind closed doors at the Attorney General's office with no public tracking? How will Texans know if the law is actually helping survivors across the state? Bottom line, House Bill 47 gives survivors new rights but fails to fund, track, or enforce them fairly across Texas.